If you're watching this video, it probably means you are ready to transform healthcare with your innovative idea, and you are looking for support to help you build that billion-dollar dream business. I've taken my 20 years of experience and thousands of hours of research and practice and really packaged that into a one-on-one coaching program to help health tech innovators like you. And when I say thousands of hours of practice and research, I'm not joking. When I was getting my doctorate in business, I picked commercializing technology innovation in healthcare as the business problem that I really wanted to focus on. And through that program, I read at least 500 peer-reviewed journal articles, every layer and angle that you could possibly imagine on the commercialization process to really be able to, one, complete the doctoral study and be able to graduate. But I really wanted to know, why were so many health innovators failing, and what were the strategies and tactics that we needed to know to be more successful? And I was able to kind of uncover that. And so let me explain why this is even so important to me, is because 95% of innovations that are brought to market fail to reach any adequate level of adoption, any financial ROI or customer adoption. And so here's a few ways that I want to list of kind of like the old ways of bringing an innovation to market. A lot of people start their business with a hunch based on their gut instincts after either witnessing a problem in healthcare, maybe they worked in healthcare, or maybe they had a personal experience with a problem and they want to solve for that. So there's definitely often a personal desire to build this business and solve this problem. Innovators and disruptors spend loads of time and money building a product, often before validating demand, over developing the product with features and functionality that customers don't want. Too many times, ego kind of gets involved in this product development process, and we start piling in all of these features and functionality, thinking that it's going to make it better, it's going to make it more valuable, it's going to make us feel better about bringing that product to market, and customers end up not wanting it. Building a product or even launching a product without mapping out the business model, so many health innovators are so passionate about the cause that they're solving that they kind of forget that they need to figure out exactly how they're going to make money, what that reimbursement pathway is going to be in order to be successful. Sometimes, we think that the cause is enough and forget that we really aren't building a charity, a nonprofit, that we're wanting to build a sustainable and profitable business. In the old way, health innovators and disruptors are really unclear on how they're going to generate both money now and simultaneously create these new capabilities for the broader vision. And what I mean by that is often health innovators and disruptors will have this really gigantic vision, but there's no way they're going to be able to execute that large vision right away. So being able to kind of figure out how you're going to map out all of that, it gets really tangled, right? And kind of how are you going to build all of this and be able to make money along the way, right? The old way, skipping over this competitive analysis and breezing through defining, the competitive advantage and the positioning strategy, really not understanding the true value of that strategic analysis and kind of wrestling that takes place and just breezing right through it, right? Wanting to move faster and skipping over some of those key fundamentals of the foundation. The old way is health innovators and disruptors often want to sell their innovation to everyone. I mean, I can help people in oncology, I can help people in multiple sclerosis, I can help people in HIV, or maybe I can help both patients, providers, and payers. And so it just really gets convoluted, and innovators are often spending a lot of time and attention and money across a variety of markets, which really dilutes things. Messaging that focuses what the innovator does, how awesome their product is, how awesome their company is, and instead of really focusing on what is that unique benefit that the target audience is going to gain from the solution. The old way is seeing pitch decks, tons and tons of pitch decks that are just really chock full, a lot of technical and clinical details, and what I would describe as all the logical reasons why someone should buy or invest in a solution, but really missing that emotional appeal in it. This one is, investing in big experienced leaders across the entire organization, all of the different functions of the business. I can't tell you how many websites you look at for innovators and disruptors, and you look at their website on their about and their leadership page, and they've got someone, that's the CEO and founder. They might have product and clinical or regulatory business development, but it's really, really rare that you see anyone that has marketing expertise.